Hi, Dr. Minkoff here. I want to talk about something that we call scar therapy. Scar therapy is really part of a greater kind of therapy, which is called neural therapy, neural meaning nerves. In the 1940s and 50s, there was a couple of German doctors that quite by accident figured out that if someone had a scar, it could be an inadvertent cut, it could be surgery, it could be an area where a tooth was pulled. That where that scar was, the nerves that are in that scar are blocked. There's a scar there. And from that scar, the flow of nerves from the brain to the rest of the body can be blocked. And if it's blocked, then the function and regulation of the brain and the rest of the body may not be right. So they found out that if you put a little bit of the local anesthetic called Procaine, actually injected it into the scar, that the scar would reverse and turn back on. You could actually open it up. And then the scar would conduct electrical flow or nerve flow properly. Now, just an example of this. I had a patient a few years ago. She had moved to Florida about 15 years ago. She'd had a C-section, and since the C-section, she'd been unable to really sweat. And so she was miserable here in Florida. She had developed high blood pressure, and she had gained about 15 pounds. I did the scar therapy on her. We take a very fine dental needle. We inject it right into the scar. It's very superficial. It's not a deep injection. It burns a little bit for about 10 seconds. And then the pain goes away. And then over about 24 hours, there's kind of a reset. If it actually opens it up, the body changes. Now in her case, the reset was almost immediately, because when she got off the table was soaked with sweat. Her body actually turned on sweating again. It was blocked as a result of that scar. Now very interestingly, over a couple of weeks, she had to wean off her blood pressure medicine because her blood pressure actually normalized also, and she lost about 7 or 8 pounds without changing her diet over the following 2 weeks. So sometimes these scars can have a very big effect on the whole body and the regulation of the body. So part of our routine when we see somebody new, if they've had any surgery or pulled teeth, I recommend that we do the scar therapy on the areas where they've had scars. It could be where they had a piercing, it could be where they had surgery, it could be where they have a mole removed or a tooth pulled, and we just go sort of start at the top and do all these areas, and it can cause a significantly improvement in how their body works. Okay, so that's scar therapy kind of in a nutshell, and it's very safe. There's nothing to be afraid of. It burns a little bit, but it's not bad at all. Okay, hope that helped.